Hello and welcome back to my channel. So in this video, I'm going to be discussing infections of the digestive system. So as I do in most of my videos, I'd like to take a quick minute to discuss the anatomy of the system that we are discussing, in this case, the digestive tract. So we'll be talking about infections that impact the mouth, but also the stomach and the intestines. We'll also talk about some other infections that impact organs that are peripherally related to digestion. So the liver, the spleen, gallbladder, that type of stuff as well, since that can have an impact on the digestive tract. A couple of things to remember about our digestive tract, especially when we get into the intestines. There are a lot of immune tissues that are present in this area. Obviously, with the digestive tract, there are going to be a large number of species that are part of our normal microbiota that are present. So we do have all of these barriers to infection. We have, things like Peyer's patches that contain immune cells that can help to fight back against any sort of overgrowth or invasion. We also have hundreds, or if not thousands, of species of microbes that are there helping to sort of defend their home through microbial antagonism, which is something I've spoken about in other videos. So let's get right to it. Let's start by talking about microbial infections of the mouth and oral cavity. The first one we'll talk about is oral thrush. So oral thrush is caused by a dimorphic fungus known as Candida albicans. We have met Candida albicans before in another video, in particular as the cause of yeast infections. Candida albicans is present on something like 99% plus of the human population. It's a perfectly normal part of our microbiota. Where we run into issues with it is if it is able to overgrow in certain areas. So typically in people who are immunocompetent, their normal microbiota, their immune system is typically able to prevent this type of overgrowth. We do see in some cases yeast infections developing in the genitalia when there's been a disruption of that normal microbiota, in particular the lactobacillus species that live there. This could be the result of activity. It could also be the result of antibiotics or other disruptions to the normal microbiota. Typically, oral thrush we're only going to see in infants or those who are immunocompromised, particularly patients with AIDS, because there's so much going on in our oral cavity that it's really hard for the fungus to overgrow under normal circumstances. The signs and symptoms of this are going to include white patches and pseudomembranes in the mouth. You can see this quite clearly in the image on the side of the screen. This is the result of overgrowth of normal microbiota. So this isn't something that you're going to get from someone. It's already present in you and it's now beginning to overgrow. And we can usually diagnose this through clinical signs and symptoms. Basically, there's not much else that looks like this, and we treat with antifungals. The one thing to note is if this is a patient who, based on your understanding, should be fully immunocompetent, it might warrant further investigation to find out why this fungus was able to overgrow in the way that it did, because it's not a normal thing to have happen in a healthy individual with a normally functioning immune system. Mumps is another infection that predominantly affects the digestive system. So mumps is a viral infection caused by the mumps virus. And the signs and symptoms include fever, muscle pain and pain while chewing, headache, fatigue, and weakness. But perhaps one of the most noticeable signs is this swelling of the parotid glands. I don't have it listed, but you can see it right here. This is where a lot of the viral replication is going to happen. And this big swelling can be very painful to the touch and is a hallmark sign of mumps. It's actually spread through respiratory droplets and saliva. And to diagnose it, typically clinical signs and symptoms are enough. You can do a PCR test, which for confirmation. This involves isolating viral DNA and trying to replicate it in high amounts so you can detect it. The treatment for this is symptomatic, but normally we don't see cases of this in the United States, or at least it's very, very uncommon. And this is because the measles, mumps, and rubella vaccine, or MMR, is part of our normal childhood vaccination schedule, which means most people will never experience this, fortunately. Now, while most people who contract mumps will have they won't have a fun time having mumps, but it will resolve normally on its own and then confer lifelong immunity on that individual. However, this is not a disease without complications, or I should say, without potential complications. And these include encephalitis, meningitis, deafness, and damage to the reproductive organs. So, obviously, deafness is self explanatory. Encephalitis and meningitis are potentially fatal. It is a viral form of encephalitis or meningitis, which means there really are no treatment options available. So, you have to hope that it runs its course. And there's also the potential to damage the reproductive organs, the ovaries, and the testes, which can suffer from certain amounts of swelling, which can be painful, but also can result in sterility. So while mumps is typically something that may not have a lasting impact on the individual, the risk of these lifelong sequelae following the infection are too great to make this something that we really want to risk the general population getting. Hence the MMR vaccine and why it's part of our childhood vaccination schedule. Now let's move on to bacterial infections of the gastrointestinal tract. So we're moving down, we're descending into the body, getting into the stomach and the intestines. So the first one we'll talk about is shigellosis. This is often referred to as bacterial dysentery. There are 4 species of Shigella that are the most common causes of this infection: Shigella dysenteriae, Shigella flexneri, Shigella boydii, Shigella sonii. These are all gram-negative rods, as you would expect, since they all belong to the same genus. Signs and symptoms include stomach cramps, fever, and watery diarrhea. And this diarrhea may include pus, mucus, and/or blood. When we talk about dysentery, we're generally talking about bloody diarrhea, to contrast that with other types of diarrhea. And we're going to talk a lot about diarrhea in this video. Sorry, can't be helped. We usually acquire this from the ingestion of bacteria from contaminated food and water. So this is one of those things where if people don't wash their hands before preparing food, or they use the bathroom in an unsanitary way and it pollutes the water supply, we can run into issues with this. To diagnose this, typically we try to isolate bacteria from the stool samples, and there are a few tests you can run. So API tests are one. Interrotubes are another very common one, or PCR. All of these lead to a definitive diagnosis. To treat this, we use oral rehydration therapy. Essentially, this is a combination of water and electrolytes. The biggest risk that we have here are people with the diarrhea, are people undergoing some type of dehydration, which could potentially be fatal. If it is severe enough, antibiotic can be prescribed. Complications include intestinal ulceration. Some strains of this carry something called Shiga toxin, which can ulcerate the intestine, causing damage. It may even result in that particular portion of the bowel needing to be removed. There's also the risk of something called hemolytic uremic syndrome, or HUS, and we'll see this a few more times in this particular presentation. Basically, damaged blood cells begin to accumulate in the kidney, and this can cause irreversible kidney damage and even kidney failure. And some people have reported chronic irritable bowel syndrome, or IBS, following this particular infection. Salmonellosis is another gastrointestinal infection that is caused by a gram-negative rod. So it's either caused by Salmonella enterica enteritidis or Salmonella bongori. Like I said, these are both gram-negative rod species. Signs and symptoms include fever, nausea, cramps, headache, and diarrhea. Notice this isn't dysentery. Typically, this is acquired through the ingestion of contaminated food, or you can also get it from handling eggshells. These are typically going to be, so the food you're going to eat is going to be either from an infected bird or an infected reptile. So that's why exposure to them can be problematic. So, for example, undercooked chicken, undercooked turkey is problematic if you are someone that happens to eat reptiles. So there are people that eat alligator, for example. It's possible to acquire it from eating those, but you can also get it just from handling them. So if you have, for example, we have a bearded dragon in my family, that's something that we have to worry about is if you handle that particular pet, you don't know if they've been contaminated. You want to go over, wash your hands before you eat or touch anything else in the house. Diagnosis is typically bacterial culture followed by an enterotube or DNA fingerprinting. So you'll see me reference these enterotubes every so often. They're a pretty neat little device that you can acquire. Essentially, they consist of 12 different compartments, each with a different sort of test happening inside of them. And you inoculate all 12 of these in this little stick formed object, and you wait until you get results, and then you interpret them the next day. And you can usually tell exactly what species you're dealing with here. So if enterotubes, you can look them up, but that's what we're dealing with. Treatment, again, is oral rehydration therapy. Replace the fluids, replace the electrolytes. And again, if this is a severe infection, antibiotics might be prescribed. Next, we'll move on to infections caused by Escherichia coli, also known as E. coli. E. coli is a gram-negative rod. There are several different types of E. coli infections that you can get. They're caused by different strains of E. coli. So it's still Escherichia coli, but usually there are subspecies or serovars that lead to different signs and symptoms. So for example, if it's enterotoxigenic E. coli, typically you experience mild watery diarrhea. If it's entero-invasive E. coli, mild watery diarrhea, but it may escalate into dysentery or full-blown colitis. Enteropathogenic E. coli results in a severe fever, vomiting, diarrhea, dehydration, and can be potentially fatal. And then there's enterohemorrhagic E. coli, mild or severe bloody diarrhea, and there's the risk of hemolytic uremic syndrome again. So this particular strain actually does carry that Shiga toxin that we saw in shigellosis, which is why it can cause all of these problems. Usually, this is transmitted through the ingestion of contaminated food or water. We used to really worry about ground beef. That was where a lot of our E. coli outbreaks used to come from, but now we're seeing it more and more from contamination of leafy greens. So your spinaches, your kales, your lettuces, and that type of stuff. And that could either be from the fertilizer being used, or it could be from people who have these types of E. coli inappropriately handling that particular produce. It can also be spread person to person, typically through a fecal oral route. The diagnosis is culturing and PCR to take a look at it. Treatment is usually symptomatic. We often don't prescribe antibiotics for E. coli infections. There seems to be some sort of interaction with E. coli and a lot of different antibiotics where it actually makes the E. coli angry, if you will, and it begins to produce more and more of its toxins. So in other words, treatment with antibiotics can actually be more harmful than helpful in some cases. In terms of complications, enteropathogenic and enterohemorrhagic forms of E. coli may be fatal due to the severity of the infection and what they can do to the body. The next disease we'll talk about is cholera. So cholera is caused by a gram-negative Vibrio called Vibrio cholerae. So you can see these sort of comma-shaped rods that this is what Vibrios look like. And this is a sample, I believe, that's been obtained through immunofluorescence, which is why they're these bright fluorescent colors. They're not actually bright yellow with a green flagellum on the end. It's just what they look like because they're falsely colored. Signs and symptoms. So this type of diarrhea is often referred to as rice water stool. So if you've ever cooked rice, you may notice that there's often like a thin layer of water on top when you're done cooking it. And it has this pale white color because, some of the stuff from the rice is washed into it. This is actually what happens, but instead of rice, the reason why the diarrhea is that white color is the people are shedding their intestinal lining. The diarrhea is so frequent, in such abundance, and so violent that they're actually beginning to shed the mucus from their intestinal lining, which is a hallmark sign of this particular infection. They will also experience vomiting and cramps. And because of the sheer amount of water that they're shedding through this, treatment has to be oral rehydration therapy, and in some cases, antibiotics if it is a very severe infection. This is going to come from the ingestion of contaminated food and water, most predominantly water. This is one of those diseases that, as we got more and more into the 19th century, when the Industrial Revolution was happening, big cities were beginning to spring up, but sanitation hadn't met the needs of those large municipalities. We begun to see this in more and more abundance simply because there was no way to properly eliminate waste from the city, and as a result, the water supplies would get contaminated. So cholera outbreaks were very common during these time periods and had devastating effects on the villages, towns, cities where they occurred. Complications: dehydration may be fatal. And if you want to diagnose this, you're going to culture the bacteria from the stool, and you're going to see these gram-negative Vibrio running around. Next up on the list is Campylobacter jejuni gastroenteritis. So this is typically a form of food poisoning. Campylobacter jejuni is a gram-negative spiral-shaped bacterium. You can see that right here. Signs and symptoms: fever, diarrhea, sometimes dysentery. So sometimes you might see actual blood in there, vomiting, and cramps. Typically, this is acquired through contaminated food. This is usually poultry, but it could also be unpasteurized milk. And you're going to hear me over and over again: don't drink unpasteurized milk. People seem to think it's healthier for you. It's not. The pasteurization process does not remove nutrients, but it does remove very harmful pathogens like Campylobacter jejuni and others from that particular food. Diagnosis is culture of bacteria from the stool. Treatment is symptomatic, and in most cases, this is sufficient. In people where the case is particularly severe, antibiotics might be prescribed. This is also a bacterium that could potentially lead to hemolytic uremic syndrome, HUS. So if you believe you've been infected by this, if you think you have a patient who's been infected by this, it's definitely something you want to watch out for. Now, the last few things we've spoken about predominantly infect the intestines, and now we're going to ascend slightly and go back up to the stomach. So peptic ulcers are a condition that are caused by a gram-negative spiral-shaped bacterium called Helicobacter pylori. So ulcers were originally believed to be the direct result of stress. People thought they were more of a physical symptom or a physical sign of stress. But actually, somebody won a Nobel Prize for discovering that they were the result of a bacterial infection. The reason why it kind of went unknown for a long time is about 2/3 of the human population have Helicobacter pylori in their bodies, but most of us don't end up developing ulcers. So quite often there's a trigger for the ulcer to begin forming. So first, let's talk about what these are like. So a lack of appetite, frequent feeling of bloating, frequent burping, weight loss. And if the ulcer begins to bleed, you might notice dark stools as blood begins to make it into the intestine and into the stool. So like I said, about 2/3 of the population have this present in their body, but not everybody develops ulcers. So to diagnose this, first and foremost, you want to culture the bacterium for the blood or the stool. So if it's in the bloodstream or if it's in, bloody stool, you should be able to see it. There's also a breath test that can be done using radio-labeled urea. And what will often happen following diagnosis is an endoscopy to actually visualize the ulcer. You can see that up here. This is what an endoscopy looks like. It's basically stick a camera down your throat into your stomach to take a look at the damage that's being caused. And this is what that ulcer begins to look like. Treatment for this is going to be antibiotics, but they're also going to use medicine to prevent the acid buildup in the stomach. Now, this might seem a bit contradictory because it's quite often the use of antacids to block acid production that allow the overgrowth of the Helicobacter pylori. Typically, the Helicobacter just kind of hangs out in the cavities within the stomach. It doesn't want to be out where the pH is very, very low. It can't really survive that. But frequent use of antacids, which people often use in times of stress, can increase the pH of the stomach, reducing that barrier to the overgrowth of Helicobacter pylori. But while we're using antibiotics to kill off the Helicobacter, we're going to prevent the buildup of acid because that's going to give the tissue the ability and time to heal. In terms of complications, if an ulcer gets particularly serious, if it gets deep enough, you can actually perforate the stomach, and this could be fatal if left untreated because now you have the contents of the stomach beginning to spill into the body cavity, which is very, very bad. Next, we'll talk about gastroenteritis caused by Clostridium perfringens. So again, Clostridium perfringens is a bacterium that we've met in a different video, particularly when we were talking about gas gangrene. However, in rare cases, Clostridium perfringens, which is a gram-positive rod, can make it into the gastrointestinal tract, and the person suffering from it will notice cramps and diarrhea. But there's also a very severe form of this called enteritis necroticans, which results in hemorrhaging, pain, vomiting, and bloating, and potentially intestinal gangrene. So essentially, you have gangrene beginning to form in the person's intestines, which, as you can imagine, is highly fatal. Transmission is typically from contaminated food, usually undercooked meat, and diagnosis is from a PCR or an ELISA taken from the patient's stool samples. Treatment for this is going to be oral rehydration therapy. However, if they do develop enteritis necroticans, it is incredibly fatal just because you quite literally have the patient's intestines rotting inside of them. Another infection of the intestines caused by a Clostridium species is caused by Clostridium difficile. So a Clostridium difficile is, again, a gram-positive rod, as are all Clostridium species. Symptoms include watery diarrhea, dehydration, fever, shock, loss of appetite, and abdominal pain. Now, the one thing I'll note about this, and if anybody's ever dealt with a patient or encountered somebody with C. diff infection, the smell is incredibly unique and unforgettable. So there are nurses who have been around long enough, doctors who've been around long enough know to recognize this basically from the smell. Typically, this is caused by the ingestion of the endospore. So Clostridium species are able to form those extremely protective endospore structures to resist stressful environments. So the big thing here is we have to, if a patient does have C. diff in a hospital room, there are special cleaning procedures that need to be followed to make sure that those spores are being eradicated before the next patient comes in, because they will be susceptible to acquiring this. It can be part of our normal microbiota, and it's typically kept in check by the other species that reside in the gut. However, chronic use of antibiotics, overuse of antibiotics, can reduce the population of the good bacteria in the gut, and this often allows C. diff to overgrow. So basically, C. diff infection can often be the result of the overuse of antibiotics. Okay. Diagnosis is clinical presentation. It's very obvious, usually, like I said, the smell, but imaging and endoscopy can be used as well. Treatment. So there are specific antibiotics that are used. In some cases, it's just a matter of discontinuing the antibiotic therapy that they're on. So if they're just on a broad spectrum antibiotic like a tetracycline or an amoxicillin, something like that, just stop using it. And quite often the normal gut microbiota will grow back, and in doing so, fight back the C. diff. However, if that doesn't happen, there are, like I said, there are specific antibiotics that can be used, but there's also a very cool emerging therapy that has an incredibly high success rate, which is known as fecal transplant therapy. Essentially, they acquire feces from a healthy individual. They dry it and pack it into pills, which I have to assume are not chewables. And you essentially swallow those fecal capsules. And basically what's happening is the feces, but the bacteria in the feces make it into the patient's intestine and then help in sort of fighting back that C. diff. Now, this is a potentially fatal infection. You might end up with focal necrosis, ulceration of the intestine, pseudomembranous colitis, bowel perforation, and eventually death. So this is something that needs to be treated very, very quickly, mostly because the C. diff can produce a couple of different toxins that can be highly damaging to the gut. Okay, so let's move on to viral infections of the gastrointestinal tract. The first one we'll talk about is rotavirus. So rotavirus causes abundant watery diarrhea that can then lead to dehydration, fever, shock, loss of appetite, and abdominal pain. This is typically going to enter the body through the fecal oral route. So in other words, this virus is shed in people's feces, and then somehow somebody puts that virus in their mouth. Lots of ways this can happen. And this is why it's so important to wash your hands, particularly after using the restroom. Diagnosis is an enzyme immunoassay. This is often abbreviated as EIA, in case you see that on other slides. And the people that we're really worried about here typically are the very, very young, because they are so susceptible to death from dehydration. They now have two different rotavirus vaccines on the market, Rotarix and Rotatech. Both of these are given very, very early on during a baby's lifetime because that's when they're most susceptible. Typically, children 12 to 24 months are the most susceptible to this and the ones we're most afraid of. Treatment for this is going to be oral rehydration therapy, although in some cases, kids can become so stricken by this that they have to spend a significant period of time in the hospital on IV drips, basically to make sure they keep their blood volume up because of how much diarrhea is happening. All right. Now we're moving on to norovirus. So norovirus is an infection that I actually have a very good story about. So norovirus is a bit weird. It is a gastrointestinal infection that causes diarrhea, dehydration, shock, all those good things, a lot like rotavirus. What's interesting about this is where rotavirus seems to be more harmful to children and less to adults, norovirus seems to have the opposite. A lot of times children get norovirus and they experience a relatively uncomplicated sort of, diarrhea, vomiting infection that passes quickly. Then the adults can get it, and it's often much more severe in terms of the infection, where they experience things like body aches, 48 hours of nausea, vomiting, diarrhea. Like it's bad. And I can tell you a story about my family getting this. So when my kids were very, very young, I believe my daughter was about 1, my son was 4. Maybe my daughter was 2, but either way, she's still wearing diapers. My son's 4 or 5. And one day he's at the dinner table and he just pukes. And we're like, oh, well, he's 5 and kids do that. So, we took care of him. He went to bed, slept, the rest of the day and all that good stuff. Meanwhile, my wife and I are like, we got to make sure our daughter's safe. We don't want her to get exposed. What we didn't think about was us. And so my son was obviously very ill in the morning. By the time the evening shows up, my wife now starts to feel not ill. And I know that you don't know my wife, but if you did, you would know that the one thing my wife doesn't like to do is vomit. It's not something she's ever done. And I've actually only ever seen her do it one time in my entire life. And it was this day where she ended up getting norovirus. And the reason why she doesn't like to puke apparently is she's incredibly bad at it. So she's sitting on the couch and she's been talking about not feeling great and so on and so forth. And all of a sudden she just stands straight up, like something horrible's happened. And I look at her, I'm like, what's going on? She's like, I think I'm going to puke. And I'm like, oh, okay. So like, go do that, right? Because that's the normal reaction, right? If I feel like I'm going to get sick, I go to the bathroom. She doesn't know what to do because she doesn't puke. So I run and grab like a bucket or a bowl or something and I bring it over to her. And she's standing in the middle of the living room, just puking, but like her head's moving all about, like trying to follow her with this puke bucket and make sure it all stays. And I'm like, I caught it all, but she's like this puke dragon, just puke everywhere. And I go, honey, I don't think you're afraid of puking because of how it feels. I think you're afraid of puking because you don't know what you're doing. So like, now she's down and it's like 7 p.m. She's a mess. She's got a fever. She's clearly really sick. By now, my son's been sleeping all day. He's been sleeping for the better part of the day. My daughter's already gone down to bed. She's 2, so she's in bed. So I physically, at this time, I was still in the fire department. I literally picked my wife up, fireman's carrying her up the stairs, and I lay her in bed. It's like 8 p.m. and I'm like, on a Saturday, and I'm like, what am I going to do? Like, what's there to do the rest of the night? I'm like, oh, I guess I'll go downstairs and play Call of Duty or something. So I'm sitting there having, dad night, adult gaming night, playing Call of Duty. And all of a sudden I start to feel that weird feeling of like, oh, my turn. It's my turn in the barrel. So I pick up all my stuff. I turn the game off. I go upstairs, get a towel, roll it up, and I get down and, now it's my turn in the barrel. So I spend the next, 30 minutes just giving the toilet all I got there. And man, is it bad. I was to the point where I'm yelling at my body going, there is nothing left. Can we just stop? And it emptied me completely out, but still for the next 24 hours, my wife and I were just no food, no nothing. I'm not going to lie to you. The puking was the initial problem with it, but I have never felt body aches like that. I have never been so exhausted. I have never been so wiped out by a disease in my entire life. We both spent the entire next day laying feet to feet on the same couch. We couldn't invite any of our parents over to help with the kids because we're afraid of exposing them, right? Our parents are getting up there in age and this could be potentially fatal for them, right? So our son comes downstairs the next morning and he is fine. Like he is fine. Like nothing happened the next day. We're half dead. And we've got this 2-year-old girl running around and he's coming up going like, I think she pooped. Like, okay. And it was literally who could physically get off the bed and go change this child. But I'm not gonna lie, this is the only illness I've ever had in my entire life where I woke up at one point and was like, if I didn't wake up again, that would be fine. This is no joke. So if you ever have the unfortunate chance of the unfortunate opportunity to get norovirus, I'm sorry. It's bad. It's brutal. The one thing that you may note about norovirus is this is one of those things where it's very common on cruise ships. So you'll see it every couple of years. There'll be a cruise ship that's like docked in a port and like nobody's getting off. And the reason why is this stuff is spreading like wildfire on the ship. So once it's present, it's incredibly contagious. So, that's my story about norovirus. Just because I have the ability to share that with you. So I hope you enjoyed it. I hope you never get norovirus. It is the worst. So we did not go to the doctor. We just assumed that this was some type of GI virus and wanted to keep it away from everybody possible. Typically it's going to resolve on its own. The big issue here is, there's no prevention for it, right? So there's no vaccine. Treatment is oral rehydration therapy. Our experience was after the first 12 hours or so, the vomiting kind of went away. It was just a matter of, do you have the ability to go physically get fluids to put in your body? And as a result, the big complication for this is dehydration. If the patient isn't able to hydrate themselves, they could run into dehydration issues. And of course, dehydration is potentially fatal. So moving on from one virus I did have to a virus I've never had, we're going to talk about hepatitis. So hepatitis is a generalized term for infections of the liver caused by the hepatitis viruses A through E. So there are 5 different viruses that can cause hepatitis. And the way we get them, their presentation differs depending on which version of the virus you have. General signs and symptoms of hepatitis: malaise, anorexia, so loss of appetite. So it's not that you're not eating because you're physically trying not to eat, you're not hungry. You may notice dark urine. This could be the result of the liver not being able to do its job. You'll get pain in the upper right quadrant because that's where your liver exists, the upper right quadrant of your abdomen. Vomiting, nausea, diarrhea, joint pain, gray stool is sometimes common. This is from a bunch of the bilirubin and stuff not being removed by the liver, and then jaundice. So that yellowing of the eyes, yellowing of the skin. So, like I said before, the transmission depends on which version of the virus you have. So hepatitis A virus and hepatitis E virus are usually ingested. So you get that through the fecal oral route. If you live in the United States, when you use the restroom at a restaurant, you're always going to see a sign on the mirror in the bathroom that says employees must wash hands before returning to work. This is why. Like, it's literally because of Hep A. Not to mention, it's just they should do that. There are other infectious diseases, but it was typically outbreaks of Hep A that led to that being something that is mandated to be present. Hep B, C, and D are usually the result of contact with infected fluids. The one thing to note about this is you can't get Hep D alone. It usually is a co-infection with hepatitis B virus. Hep D cannot replicate without the presence of Hep B. The one thing to note is if you have both Hep B and Hep D, usually the signs and the symptoms and the ability for Hep B to become chronic are going to be enhanced because of the presence of the Hep D virus. Diagnosis is going to be blood tests for liver function and then serology to detect the virus. Now, there are some vaccines, but it depends on the strain. So hepatitis A virus does have a vaccine. This also protects against Hep E because they're very similar. The Hep B vaccine also protects against Hep D because if you don't get Hep B, you can't get Hep D. For Hep C, there currently is no vaccination. What I am showing you on the right are signs and symptoms of jaundice. So this is the yellowing of the skin, and this is the yellowing of the white part of the sclera of the eyes. Treatment. So for Hep A, B, D, and E, usually supportive treatment, rest and fluids is sufficient. For the most part, your body is able to get rid of those viruses over time. Hep A is relatively uncomplicated. However, Hep B can in some cases become chronic, and this becomes more of a problem if it's Hep B plus Hep D. In the case of Hep C, the old school treatment for this was interferon. That's one of those antiviral cytokines that your body produces, and protease inhibitors, which are going to help prevent the replication of the virus. However, there are some new antiviral medications on the market that seem to be effective in completely eliminating Hep C from the body, which is great. For complications, again, it's virus dependent. So for Hep A, there's none. You're just symptomatic treatment, keep the patient going, keep the patient going, and their body will rid itself of the Hep A on its own. Hep B can become chronic, and this can lead to cirrhosis or liver failure. There's also believed to be an increased rate of hepatocarcinoma following infection. And if it does become chronic and it isn't treated, so, leaning more into the antivirals and things like that, it is potentially fatal. Again, this is rare, and because of the presence of Hep D can become more likely that some of these abnormal complications can occur. Hep C, on the other hand, is very likely to become chronic. In about 75 to 85% of all infections, the infection is chronic and stays with the person for life. And again, this is an oncovirus, which increases the rate of hepatocarcinoma. That's why it's been so important in the past decade or so that we now have effective antiviral treatments that can get rid of Hep C. So when I first started making these videos, the original hepatitis video basically says you can't cure Hep C. Now we can. So that's how recent that particular intervention has become. And Hep D, like I said, co-infection with Hep B just makes Hep B worse. For Hep B, there's none. There's really no complications associated with that. Okay, so let's move on to protozoan infections of the gastrointestinal tract. The first one, went a little far there. The first one we'll talk about is giardiasis. This is caused by a protozoan called Giardia lamblia. It does also go by a few other names, Giardia intestinalis, but I'm sticking with the original name while they try to figure out how they're going to decide on this. It is a protozoan, like I said. It's this guy right here. It's the big purple kind of stingray looking thing. And what actually what happens is there are like suction cups on the bottom of this, and that's how it sticks to your intestine and hangs out there. So diarrhea, nausea, stomach cramps, gas, greasy stool are all very common. And you get this by consuming food or water that have been contaminated with the cysts. So this is what we call the trophozoite stage. This is what it looks like when it's kind of active and doing stuff. It can actually form this really small round cyst that is protective. So it can do that in the water because there's no food source, there's nothing around. And then when you ingest it, it hatches, if you will. It goes into the trophozoite stage where it can actually, eat and reproduce and cause damage. This is also spread. So to give you an idea of the transmission, you can get this by drinking fresh water. So I happen to live in New York. You can get this from any of the Finger Lakes, things like that. If you're not boiling your water or treating it some way to remove contaminants, it also spreads like wildfire inside of daycare centers. The main reason being kids are gross. That fecal oral transmission route is still available. So if a kid gets it, the cysts can be shed in the stool. And then if they contaminate other objects with the stool and the kids touch it or put it in their mouth, they get it. And like I said, kids are gross. They don't really know things about hygiene and so on and so forth. Diagnosis, do a stool sample, look for the cysts. You can also do an ELISA to detect antibodies against the Giardia. There is no prevention for this. Don't drink contaminated water, basically, but you're not always going to know. Treatment, oral rehydration therapy to get rid of it. Usually it resolves on its own. You can go with some antiparasitics to get rid of it as well. Complications, chronic infection. So people can end up kind of being stuck with this until they get the necessary treatments to do that. All right. Cryptosporidiosis is the next infection that's on our list. This is going to be caused by either Cryptosporidium parvum or Cryptosporidium hominis. Those species depend on which animal it's coming from. So Cryptosporidium parvum is going to come from cattle, whereas Cryptosporidium hominis just infects humans. The description is a protozoan. So this is what you're going to look like. This is what it looks like here. This has got a fluorescent stain on it, so you can see it a little bit better under the microscope. Watery diarrhea, nausea, vomiting, cramps, fever, dehydration, and weight loss are typically how this is going to be spread. Usually you're getting it by either coming into contact with an infected animal, in particular their feces. So you can get exposed to this through like cow manure, for example, or if you happen to have a job that involves being around other people's feces, if they're infected with Cryptosporidium, you can get it as well. You can diagnose this through a stool sample or through PCR. There really is no prevention from this, nor are there any major complications. Typically, oral rehydration therapy is enough so their body can fix it. But like I said, with Giardia, antiparasitics are also a possible treatment for this, particularly if it's an infection that's not resolving on its own. Next is amoebiasis. The major culprit behind this is going to be an amoeba, a protozoan, called Entamoeba histolytica. You can see that right over here. Now, it can range, the signs and symptoms can range from mild diarrhea to amoebic dysentery. And depending on how severe the symptoms, or I should say the signs are, is how concerned we ought to be about this. So mild diarrhea, it's possible it could resolve on its own. But if people are experiencing severe amoebic dysentery, they're going to die if you don't treat them. So transmission is, again, water contaminated with feces. So if this is, if somebody has this and then they use the bathroom and it contaminates the water supply, it's possible to get this. Again, this is most commonly found in places with poor sanitation. You can diagnose this through a stool sample, immunologic tests, or if the disease has progressed far enough, an MRI can be used to detect liver abscesses, and this is often what happens. So this particular amoeba will infect the intestines, but it has a taste for the mucin protein, which makes up a primary component of the mucus that lines your intestines. So essentially, it's eating your intestinal mucus. Once that mucus is gone, you've now lost a protective barrier there. And at that point, it can actually break through the intestinal wall and begin to infect other organs. So prevention for this is none. Treatment is antiparasitics, but the complications are really problematic. You can get liver abscesses. So essentially, it leaves the intestine, attaches to the liver, and begins to eat your liver, which obviously is fatal. This can also occur for other organs, lungs, heart, pancreas, things like that. You can end up having chronic infections with this. So some people, they may not have these horrible signs and symptoms, but they're chronically infected with it, which means they can continue to shed it and spread it to other people. And obviously, if none of these situations are resolved over time, the person can die. Another protozoan-based infection of the intestines is cyclosporiasis. This is caused by Cyclospora cayetanensis. Signs and symptoms: explosive and watery diarrhea, fever, nausea, vomiting, cramps, loss of appetite, fatigue, and bloating. This protozoan is very small. You can see it right here. Transmission: food and water contaminated with feces. This is often going to be spread through the consumption of fruits, particularly berries. There does seem to be a seasonal fluctuation of this particular disease. In certain South American countries, it's known as the mal de mayo, or the sickness of May, because that's when those particular fruits end up getting harvested. And if it's something that came from either human feces or some other type of fertilizer, it can be on there. And the big issue here is things like raspberries, other berries. People don't wash them as well because they're fragile, right? So if you really scrub an apple or you really scrub a potato to get anything off, that's easy, right? You can't do that with things like raspberries, blueberries. You can damage them. So as a result, they don't often get washed as well. And the Cyclospora cayetanensis can spread from one person to the next. A stool sample plus fluorescence microscopy is typically used to diagnose this. There is no prevention for it. Treatment is going to be with antiparasitics. There really are no complications with this. Once it gets treated, it usually resolves pretty rapidly. I will end here with some helminthic infections of the gastrointestinal tract. I'll warn you, this is a bit gross, but Hey, you're the one that's going into the medical field, not me. So, all right. First one is ascariasis. So this is caused by a roundworm known as Ascaris lumbricoides. Signs and symptoms, quite often, this infection is asymptomatic. But because the way so typically you eat these, right? You eat food or drink water contaminated with the eggs. They actually make it into the lungs. They develop into their larval stage, and you cough them up and swallow them back into your intestinal tract, which is kind of crazy. Um, so as a result, there's often pulmonary involvement, shortness of breath, cough, abdominal pain. Then they can cause weight loss and fatigue as they make it into your intestines. And essentially, they're just going to live off of your food, right? Diagnosis, stool sample, and imaging. Sometimes it takes care of itself. People begin pooping out the worms. That can happen. There is no prevention for this. In many cases, this is actually a self-limiting infection. In about 2 years, it resolves on its own. But if not, you might end up with intestinal blockages. So here's an intestine that is just packed full of these guys. This is what this person's intestine looked like. And as you can imagine, intestinal blockages are fatal. In the stool sample, you're not usually looking for worms. If worms come out, we have there you go, dead giveaway. You're looking for the eggs. You're looking for the roundworm eggs there. So this is ascariasis. It's not a significant problem in the United States, but it is very problematic in parts of the world where sanitation is very, very poor. So is hookworm. So hookworms are interesting. Rather than being ingested, typically these make it into your body through skin penetration. So there are a few species. Necator americanus is very common in what they call the New World. So the United States, Canada, places like that. Ancylostoma duodenale is Old World, so Europe, Asia, things like that. And Ancylostoma brasiliensis is very common in South America and the New World as well. It is a roundworm. And signs and symptoms. So again, the lung thing, right? Cough, itchy rash. That rash is typically going to be where the skin penetration occurred. Loss of appetite, abdominal pain, and diarrhea. And in some cases, you can actually see these are the worms crawling under the person's skin, and they're causing a massive amount of inflammation as a result of this. Diagnosis, you will see the eggs in a stool sample. Prevention, there is none. Basically, you just don't touch these guys because they will burrow in. By the way, you don't feel it. You don't feel it when they burrow in. Treatment, antihelminthics. Complications, anemia, because they will begin to eat your iron and take stuff from you. And one of the things we notice is children who are infected with these often have cognitive and physical developments affected by this. So they may struggle to learn. They may not reach their full, height, body weight, that kind of stuff as a result. So there's a big concern for children who get this because it can have pronounced effects on their development. Strongyloidiasis is caused by a roundworm called Strongyloides stercoralis. This also, and what you're seeing with these worms is they often have a very complex life cycle. So again, signs and symptoms are very nonspecific. Like it really varies from person to person. Again, these are going to get in through skin penetration. There's usually a rash at the entry site, but then the signs and symptoms get very weird. Cough, fever, nausea, breathing difficulties in some cases, bloating, pain, heartburn. You might get all of these. You might get some of these. It depends on the patient. They will come out in the stool sample. There is no prevention from this, and you're going to need to prescribe antihelminthics. So what's really interesting is these can actually be asymptomatic for a long time, but then the patient goes on corticosteroid use for some other reason, or maybe they're having some of these symptoms and the doctor says, oh, let's try some steroids to see if this isn't like an immune thing. And then it just jacks these worms into hyperdrive. And now you get these massive signs and symptoms, and that starts to point to, oh, this might be strongyloidiasis. There's also something that happens in immunocompromised individuals called hyperinfection, where these guys, again, they start to overgrow in massive quantities, causing these really disastrous signs and symptoms. And this can actually be fatal in some cases. Few more to go. The next one is enterobiasis, also known as pinworms. So Enterobius vermicularis is the culprit here. It is a roundworm, but this one is relatively innocuous compared to some of the ones we've just spoken about. This is actually the number one cause of rectal itching or anal itching. So basically what happens is this gets in through the fecal oral route. They live in your intestines, which is why you might get abdominal pain as a result of this, often asymptomatic. But what you might notice is insomnia. This happens a lot in children. And as a result of the insomnia is actually caused by the fact that at night, the females come out, they pop out of the anus onto the rectum to lay their eggs. And that is itchy. It causes itching and irritation, and the kids are itching their butt all night, which means they're not sleeping very well. So you might notice that the diagnosis for this is actually something called a tape test. So like I said, at night, the females will come out and lay eggs around the rectum. Using a piece of Scotch tape, you just touch it to the rectum of the person, and you'll actually find these eggs like in a little ring around their rectum. That's how you diagnose it. The treatment is actually fairly easy. Antihelminthics work very, very well, and there are no complications associated with this. Another roundworm that can cause an infection in the gastrointestinal tract is Trichinella spiralis. So signs and symptoms can range from mild to serious depending on the nature of the infection. Typically, you acquire these by ingesting the cysts, and those cysts are often located in the muscle meat of pigs. So this is why cooking your pork thoroughly is very important. Mild symptoms include diarrhea, abdominal pain, constipation, muscle pain, fever, cough, chills, or conjunctivitis. However, depending on where these things insist, in which muscle tissues they insist, you could get issues with muscle coordination, breathing, and the heart, which could potentially be fatal. Rarely, but if it damages the right muscles, you can get that issue. So here you're seeing the worms and the cysts that are embedded in the tissue of somebody who's been infected with this. And this is what you're looking at. You do a muscle biopsy and you're looking for these inclusions. There's no prevention for this. Cook your pork thoroughly. Treatment is antihelminthics and possibly steroids to help the body rid itself of the worms. It is fatal very rarely. Again, it depends on which muscles are being infected. And the last infection we'll talk about they're collectively known as teniasis. It's hard to pronounce, teniasis. Basically tapeworms. So there are 3 different species that are relevant to this conversation. One is Taenia solium, which is the pork tapeworm. Another is Taenia saginata, which is the beef tapeworm. And then Diphyllobothrium latum, which is a fish tapeworm. You're going to acquire these by ingestion of the eggs. In other words, you're going to eat infected, undercooked meat. That's where you're getting it from. Okay. And that's one of the things that we need to point out to people. Like, people think, oh, sushi's a thing, right? So you can eat raw fish. You need to eat sushi grade fish. You can't just go catch a salmon in Lake Ontario and then say, yeah, I'm going to eat it raw. It might be contaminated with Diphyllobothrium latum, and now you're infecting yourself with it, right? So these can be asymptomatic. Tapeworm infections can be asymptomatic. If you do notice it, nausea, diarrhea, flatulence, and hunger pains are often associated with that. Quite often, the first time people recognize that they're infected with a tapeworm is when it comes out. Basically, they go to the bathroom and they realize they've just passed a very large tapeworm. If you suspect you have a tapeworm, you can go to the doctor. The diagnosis is for looking for the eggs in the person's stool sample for that. There's no prevention for it. Treatment is with antihelminthics. The one thing that is potentially fatal is something called neurocysticercosis. Essentially, the tapeworms make it out of the intestine. They go to other parts of the body, in this case, the brain. And if they get in there, that could be fatal because obviously damaging the brain is problematic. So that concludes our conversation on infections of the digestive tract or digestive system, or however you want to label it. I hope you learned a lot. Sorry that a lot of this was particularly gross, but it's what you get when things infect the gastrointestinal tract. Thanks for paying attention, and I'll talk to you all soon.